So let's jump into it. First of all, thank you everyone for attending. The Business Council is always delighted to bring this level of quantitative information to the public. We definitely see it as our role to inform factual data, inform content and information that the people of this country as well as the market can directly respond and appreciate on how we're developing our business, our commerce this year. So today I've got the privilege of providing a series of numbers and data that we collected under our COVID-19 vaccination for business survey. And definitely it's a privilege that all the businesses that have participated and have taken time to present this and to help us convey this information so that we could highlight this to the public and certainly to those that have positions on vaccinations in the private sector. We also welcome those interactions in their thoughts and positions as well. So just to give you a high-level appreciation on our methodology and the responses, we conducted this survey between the months of June all the way to the first week of August. As much as possible, we wanted to grab a good spread of the market, and principally we asked the question to chief executive officers, country managers, managing directors or their equivalents. And to give you a perspective, 150 responded, and the 150 that responded, they represent approximately 20,000 employees right across the entire country. And so that survey and the perceptions and the outcomes that we received, it is a reflection on businesses that have large workforces, and these workforces that they have, their thoughts on tackling the COVID-19 in different business continuity plans, applying different forms of nuclear passing protocols. Those are the key things that we wanted to hear from them. And subsequently, we also had a very dedicated series of questions on vaccinations and the positions of these CEOs on vaccinations. Again, just probably wrapping up on the methodology and respondents, the breakdown of the companies, just to give you some percentage, 59% of those CEOs were from privately owned businesses, and then 15% of them were family entrepreneurial businesses. So as you can see, and then the subsidiary and the multinational group of companies was another 15%. So if you look at those numbers, approximately 90% of the numbers that we received were from private sector, and then we had 9% were from public companies, another 2% were from state-owned enterprises. Just to give you a average gender composition of employees, because we wanted to look at the lens of workforce in the gender space, of that 20,000 that I mentioned, 58% of them were male and 42% of them were female. So the employee composition is definitely an important indicator as to the various impacts that COVID-19 has had Again, I'm just going to run through these numbers very quickly. 27% employee headcounts between 101 to 500. 23% from 50 to 100. But the largest percentage is 50 headcount and below, which is 32%. And we had roughly 8 to 9% on employees from 501 to 1,000, and 9% 1,000 and above. So that gives you a fair idea that much of the workforce that we were targeting responses around, it came from that 50 below, and a small portion of that was 1,000 and above. So again, without going into greater detail, there were 25 sectors that responded to this survey, and these are business operations right across the whole country. So what I'll do is I'm going to highlight the key subject matters of business costs, herd immunity, critical employees, and then the vaccination questions. And as I go through that, I'll just prompt the themes around that. Okay, so when we look at the business costs, number one, a majority, which is around about 86% of the organizations that were surveyed, shouldered the cost related to COVID-19 prevention and the management of employees. So if we break that down, face masks and sanitizers, 70% of those costs were in that space. 21% of those costs were in testing employees. And then 11% was on building up their own clinics and medical facilities. So what we saw in the marketplace, and to give you some numbers around that, 70,000 kina on average was for face masks and hand sanitizers that these companies spent. And then you had a further 166,000 kina for testing kits, but there were also some businesses that actually purchased their own ventilators. So that 70% percentile is basically the average cost of what they spent on hand sanitizers, testing kits, and ventilators. But this is probably, this next stat is probably the one that I think is quite interesting. Some organizations spent up to 50,000 kina to 9.5 million kina to set up their own in-house clinics and medical facility for employees. So that's indicative of the fact that because the public health system was highly compromised, the private sector had to fork out its own resources to build its own clinics and hospitals. On top of the ventilators and the test kits and the hand sanitizers that they all spent their resources around. Through those 64% have medical insurance to cover their staff. Again, this is an interesting statistic. Only 19% have coverage for COVID-19 and related medical issues. Okay, I'll just repeat that again. 64% indicated they had medical insurance. 19%, only 19% had coverage for COVID-19 and related medical issues. So if they were diagnosed with COVID-19, that was the only percentage of employees that had access to medical cover. The rest, they had to fit their own bill. And just to give you an average on what that type of care would look like, some private hospitals have upwards to almost 3,000 to 7,000 kina per day, and even more in terms of COVID-19 related healthcare support. So only 19% have that medical insurance to cover that cost. And if I can just expand, this 19%, it's actually quite, it's an improvement, because last year, on average, there was no medical cover for COVID-19. So now that we're seeing the medical insurance bringing in protocols around COVID, it's a clear indication that the medical insurance in particular are now changing their scope in having coverage on COVID-19. All right, so that's the cost, that's the business cost on COVID-19 related expenditure. I just want to move quickly on productivity. Aside from the financial losses, a majority, 71% of businesses also suffered from productivity losses amounting to less than 500,000 kina, while 12% range from 1 to 5 million. So what that basically means is 500,000 kina is not recuperable, it's gone. And 71% of the respondents indicated that. And then 12% said the range between 1 to 5 million was the losses that they suffered. So again, these are numbers that we're looking at in this recent period. They're not from last year. So I just want to move on to herd immunity now. 46% of respondents have no measures in place to achieve herd immunity yet. Of this number, 8% find implementing herd immunity measures to be challenging due to employees' high rate of vaccine hesitancy and the refusal to wear masks and get tested. So we've got two distinct challenges here. 46% don't have the belief of herd immunity in achieving that. 8% indicated that it's absolutely impossible, given the fact of vaccine hesitancy and also the fact that they are refusing to wear masks and get tested. 63% of those who had critical employees infected by COVID-19, they suffered major business losses such as revenue loss, temporary closures of operations, scale down on productivity and losses. So I'm just moving into critical persons. 85% of the respondents are willing to participate in a private sector initiative to vaccinate private sector employees, while 15% are not willing to participate, primarily because of the following reasons. There's a government vaccination program, or there's a high rate of vaccine hesitancy among employees. Okay, so I'm just moving into the vaccine narrative now. However, business leaders have a strong preference on vaccinating all employees, but they recognize the challenge of having high vaccine hesitancy rate among their staff. 2 out of 3, 66%, business leaders surveyed are also open to shoulder the cost of vaccination for their employees. And to conclude this short summary, a majority of business leaders surveyed are still uncertain about whether or not their organizations can support the vaccination program for private sector employees and the wider community. 54% are unable to determine at this point whether their organizations could support a private sector vaccination rollout, while 51% cannot say at this point if they can support the rollout for the wider community. So the key outcomes that we've obviously observed from this survey is that, number one, CEOs find it increasingly important that a workforce that's vaccinated is a workforce that will be productive and that will achieve the safety standards that they desire in order to make their businesses grow and move forward. That's the overall outcome that we've identified in this survey. However, as is expected, and we've seen this in different companies, the positions on vaccination by employees have indicated a large vaccine hesitancy community that's out there. And so there are challenges that do lay ahead in the CEOs and MDs in balancing that objective of a safer workforce and the use and the application of vaccines in the workforce. The second thing that you would have noted in this survey is that there is massive amounts of investments being put by the private sector in applying non-vaccination equipment. As I mentioned, some have gone to the extent of opening up their own hospitals, clinics in their workforces, even outsourcing private practitioners to be doctors embedded in their companies. And then you just heard the cost ranges of personal protection equipment, face masks and hand sanitizers, between 70,000 to 150,000 in ventilators as well. So the facts as they are, that's the perception of the CEOs that are in the marketplace. I just want to make a distinction on business models that have been applied, and that can give you a perspective on why there is a high preference from the CEOs and the MDs, why they want vaccination. The first thing is companies that have 24-hour operations and companies that have very, very sensitive pieces of infrastructure and skills. When I mean infrastructure, I'm not just talking about equipment, I'm talking about people as well. And these skill sets, they are absolutely central to the delivery of the value chain of the business, the success of the business. If they were to be compromised in prolonged periods of being sick, in this case having the virus, then that entire value chain will come to a grinding halt. And that halt, it's not just a company challenge, it can also be a national challenge. So just to give you an example on critical employees, we're talking about folks that are vital to the company's day-to-day operations. They interact face-to-face with customers or guests as part of their jobs. They're vital to the company's operations, and they're unable to work remotely. If there's a 100 million kina machinery, they have to be physically there to work on it. They work on the company's production line, and they frequently travel domestically or in some cases internationally as part of their jobs. So these critical employees, again, just to break them down, for more than a quarter, 27% of them, yeah, 60 to 90. So a quarter of the CEOs indicated 60 to 90% of their employees are actually critical employees. Okay, so that gives you the number that a very, very large portion of the workforce in a quarter of these businesses are critical employees. And 58% of them are males and 42% of them are females in that critical employee space. Now this is again an interesting stat. 24% of them reside in the National Capital District. And then the breakdown is as follows. 14% of them are in Morobe, 6% of them are in East New Britain, 6% of them are in Western Highlands, 5% of them are in Eastern Highlands, 5% in Madang, and 5% in West New Britain. So the reason why these numbers are quite critical for us is if anything was to happen to them, the parts of the market will be compromised. So let me just give an example on what a critical person and a national significant shutdown of a service may entail. Banking and telecommunication ICT server managers, systems managers, engineers, those sorts of people. If anything was to happen to them, then definitely the banking system will shut, because they're the only people in the country right now that know how to work on that machine. And in most cases, they can't work at home. They have to be physically there in that workspace environment. Okay? An obvious one would be pilots, both in the seaport and also in the shipping and also in the air transport area. And there's also examples that we can further see on senior managements that have highly specialized skills in the delivery of those companies. So these critical employees, they need to be in an environment where their processes, their machines, their ability to carry out and discharge their functions, it needs to be free from any form of COVID infection. And companies have deployed several measures that are in many ways going to be complemented by the vaccination, but they're not necessarily functioning with the need to be vaccinated. Okay, I just want to make that distinction. So an example of that is bubbles, business bubbles that they've identified in their operations. So a 24-hour operation like a mine site, an oil and gas site, or even a fuel refinery, they would need their engineers and their operation maintenance teams to live in those compounds, in those factories, and cannot come back home for a prolonged period. So that bubble effectively shuts down their movement and shuts down movement of people coming in and out. Those bubbles are designed because of the nature of the business. It's 24-hour operations, and it's cyclical shifts, 12-hour, 8-hour shifts. So if anything was to happen to one crew, then you have an 8-hour gap in that 24-hour operation. And that's one of the reasons why these bubbles, they started emerging earlier this year. They continued, and they're still in operation this year, where absolute strict protocol is identified. For example, pilot ships operated, no one can enter those ships except those that are part of the crew. So they've got very, very strict protocols in interacting with those critical employees. So now, that type of model can only be functional at a particular period of time. You don't want, you and I, we don't want to be away from our family for more than a day. Some of these folks are 3 months completely isolated from their families, being locked down in a bubble. And that's one of the reasons why the vaccination arrangements are much more attractive to businesses, because it creates that non-infection environment around around that bubble, around that workforce. So the biggest thing that we're really trying to achieve right now is how can you complement the bubbles? And there is a limitation that the bubbles can have in a non-vaccination environment. You have your clinics, you have your PPE equipment, you have your ventilators on standby, you have your doctors, but it needs another layer, and that's the layer where vaccination becomes a critical component in ensuring that those value chains, 24-hour critical value chains for the market, are safe and free from COVID infection. But that's basically where we've seen the market move. There are some companies right now, I can say with absolute certainty, they have a complete vaccination policy. You can't come to work if you're not vaccinated. And that's because their clientele, little children, for example, their clientele are people that they're interacting with. So those sorts of strict policies on vaccinations are largely coming in because of the type of business that folks have. More human interaction, vaccination policy, company policy is going to be critical. More critical persons inside significant production chains, you're going to see that same type of position with companies. So again, I just wanted to highlight that is the motivation for the private sector and vaccination. The final thing I just want to quickly mention is, as I said previously, the Food and Drug Administration in the United States has approved one vaccine, which is the Fisa vaccine. And that approval has effectively, especially in the United States market, it's effectively given confidence for public and private organizations to now make vaccine mandatory. I mentioned earlier the United States Armed Forces, its entire military, there's now a policy on full vaccination. So you're looking at one of the largest employees of the United States market, 10, 15 million people or even more now have to undergo a mandatory vaccination drive. What does that mean for Papua New Guinea? The FDA approval means that one of the first sectors that we will probably see vaccination, mandatory vaccinations, it's probably going to come through international travelers. Now that a body has now approved Pfizer as the vaccine, and just for the appreciation of your readers and viewers, last year and parts of this year, they had an emergency approval to manufacture. They didn't have a full FDA approval. Now that they have FDA approval, we're probably going to see an uptake of markets, an uptake of airlines, making the vaccine jab important before you're able to travel and collect your visa. or even get a visa. That would most likely be the next follow in starting to open up the market. So again, in our estimation, that mandatory vaccine policy would most likely come through international travelers. Apologies. Okay, so those are the quick things I just wanted to mention today. The entire pack will be on our website. You can certainly download and go through the materials. Are there any particular questions that you'd like to ask me on the survey in the first instance?
What's the Business Council following the survey and the response that you get from these businesses and the CEOs? From the Business Council point of view, is it a positive sign for businesses to get back to normal, or with the hesitancy in the uptake of vaccination, negative thing, or what's your view on all this?
I guess the critical thing for us is there are very, very sensitive value chains in the market right now, which do need to be COVID infection free. And whether that COVID infection free ecosystem is vaccine driven or not vaccine driven, that's immaterial as far as we're concerned. So we can't force people to get vaccinated, and no one can, not even the government. But if you're in a particular ecosystem, you're in a particular environment that is sensitive, and it requires those, then vaccination has to be followed and abided by. And that's the key message that I'd want to share today. We now know what those sensitive sectors are. Everybody knows that. If we don't have fuel, the trucks can't run. If we don't have banking, we can't go and trade, and so forth. Those businesses that are feeding the market, they're the ones that we need to be absolutely sensitive to. And those companies are fully aware of what's at stake. So the vaccine hesitancy, it's part of our business cost now. We've absorbed it. If we know that a particular part of the market and the operations are super sensitive, we have to ensure that it's protected. And the others that are in and around there, we have to make those adjustments. So so the answer to your question is vaccine hesitancy or no vaccine hesitancy, the market's continuously going to move forward. And eventually, through different types of protocols, different types of applications of nucleopasin, we can still make the market move forward, which is exactly what's happening today.
It's unfortunate that some of the businesses had to set up their own clinics, hospitals to cater for, to make it, they take it on board in the budget and expenditure in order to have the clinics and hospitals set up to cater for COVID-19 issues and all that. What is the message that maybe the business, those 150 CEOs that have been surveyed, and those businesses that have set up their own clinics and all that have to say about the government run hospitals and clinics, facilities and all that.
It's a horrible comparison, but it demonstrates the private sector position. I think all of us here have suffered blackouts these past couple of weeks. We can either wait for PNG Power to put the power back on, or we go out and buy a generator to live in our homes. And that's exactly what the private sector has done with these sorts of investments. If they can't protect their employees to sustain the value chain, they know that they're going to suffer in making the returns and the objectives that they want to do. So I guess to answer your question, similar to what Melissa said, the cost of doing business in COVID, in this instance, COVID-related cost of doing business, this is something that they have to absorb in order to survive. They obviously have positions on the inability of the public service to absorb this health crisis, but you either complain or you have to invest and fix, and that's what we've seen with these companies. In one instance, they had to bring their own ventilator in a private sector hospital because the ventilators were all used up. So it's not just government, it's also private sector facilities as well. In some instances, private sector hospitals ran out of PPEs, they had to bring their own gear into there as well. So it's not so much a public-private health challenge, it's a market challenge, and businesses are responding to that challenge. That was one of the reasons why we asked them if you had vaccination challenges, bringing them in, would you buy them or not? And they overwhelmingly said, we'll buy them in the absence of a government facility. But now COVAX has provided, now Johnson & Johnson, AstraZeneca, and Sinovac, Sinopharm, that's not a challenge anymore. There's government-run facilities now. But prior to that, we weren't sure earlier this year whether those were coming in. And that was when businesses were preparing themselves to explore acquiring them for their critical employees. But yeah, surely that's effectively where we are in the market.
And Joe, I think it was with mainland audience, 2 weeks or so, there were complaints coming in, not from the employees of mainland audience, but I think it's with contractors. So like, did any of the CEOs, when they were surveyed, mention anything around having contractors involved in all of this? Because the contractors are now protesting against this particular company with regards to vaccination, because the company put out a policy that all of its contractors, including employees, needs to be vaccinated, and we understand the nature of their business. But I believe, what did they actually tell you guys about how the awareness around how important that business is and what it means for them to be vaccinated in order to allow the value chain, like you said, to go on?
Yep, definitely there's been active conversations with the employees, with contractors on the need for critical elements of the business to have those non-COVID infection environments, and as I mentioned in that previous stat, you're looking at yeah. So you're looking at approximately 60 to 90% contractor and employees that are in that critical employee space. That was what 27% of the CEOs identified. 60 to 90% of my employees and contractors, they're critical. So if anything happens to them, my value chain will effectively come to a halt. And I think it's important. I'll give you the reference. Look at slide 9 of the report, because slide 9 gives you 5 characteristics on what is a critical employee, and I read them out. You know, day-to-day operations, face-to-face, unable to work remotely. They're in the production line. They travel domestically and internationally, part of their jobs. These 5 characteristics, it makes up that 60 to 90%. And so, for example, companies like Mainland Holdings, it would be this sort of category, these sorts of features that they would say, if an infection happened and we couldn't control it, parts of our operations will just completely come to a standstill. So it might be worth further finding out from Mainland what exactly is that 60-90% part of them as well, and which of their employees are in those 5 categories that would have that impact. Again, each business has a different definition on critical persons, but these 5 are pretty much generic right across the market. So they're not necessarily positions. It's not like a CEO is more critical than a driver. It's basically these 5. And they are the ones that anything happens to them, there's a complete challenge in the firing up that business.
Mr. Henna, from the survey that was carried out, I understand from the steamship's report that was released yesterday, I think, that the hotels business, under their hotel business, they were doing quite well during this COVID period. Were there some reactions from other maybe sectors that have indicated that they were doing a bit well during this time, especially in terms of quarantine and all that? Steamships indicated that, especially workers from those that have traveled overseas, the expert workers and those that need to be quarantined before they released to the sites, especially the mining workers and all that. Yeah.
I haven't read the report, so I can't comment with a degree of confidence. What I can say is the extractive industries work very, very hard on a fly-in, fly-out bubble model that allows those critical frequent travelers going back and forth. They are critical persons because these skills that they have, it allows the market to produce gold, and there's a whole lot of other things that it's highly specialized in. So the FIFO arrangement, it's one of the, I'd say it's one of those very, very quiet success stories that we've got in the market, where there are these critical folks going back and forth, but at any time they can shut down. And so the bubble they've created is quite strict. They're in quarantine, they get on a plane, they're in quarantine, they go straight into work, they're in quarantine, they get on a plane, they're in quarantine, they go home, and vice versa. So they're completely shutting off any infection rate. And of course, vaccinations is mandatory in order to get this bubble functional. So if you really want to see what a operating environment that folks have invested a lot of time and energy around, and governments and state governments have done, is the 5-4 arrangement is a very, very strong example on what can happen. And we have to give credit to the Queensland government because it's not handled at the Canberra, it's not handled at the federal government. It's the Queensland government takes the lead on this, and also the leadership here in PNG, the National Control Centre, and the mining and the oil and gas companies. They've effectively arranged for this bubble, and it's been operational for almost several months now, 6-9 months now. So that would be, I'd say, a cross-border success story that we've been having. They don't want to call it a bubble, but technically it's a travel bubble that we have functional. Yeah.
Once adding on to that, and then you mentioned about productivity, I think when they were introducing these bubbles, there were certain concerns being raised, especially from those employees in the oil and gas mining, the extractive sector. So the concerns were around the added hours onto their shift, the normal shifts, because they had to make up for hours of those who were still in quarantine that needed to go, and then they'll go off. Like, what did they improve on that? Were there some discussions that you guys got involved in?
Yeah. These are very, very, very good questions, because it goes into the heart of what is the business continuity plan for these operations, and they're best answered by those entities. What I can say for certain is productivity did drop. There were financial costs to the businesses, but the continuity plans are always being updated, and so those continuity plans and even things like fatigue, mental health, all those stress-related challenges on shifts and all. The right folks to answer that question would be the Chambers of Mines and Petroleum, but specifically those companies. And I definitely encourage you folks to ask Albert Mellam to get a feedback on those stress-related challenges. Is it permeating into the marketplace? Well, the answer is absolutely yes. And there is definitely protocols and systems to look at balancing, especially the critical persons. If you're able to increase the critical persons list, then those jobs would be shared. Or the other thing, which is not entirely happening at this market at a very prolific rate, but there's also a lot of automation going on. People are now being replaced. Critical infrastructure, critical persons are now being replaced with critical infrastructure. But that again has another added cost. So yeah, there's a lot of experimentation on workplace business continuity plans going on. We're definitely keen to track where those are going. But I certainly hope this survey has given you a fair idea that massive costs of business are now piling up because they have to create their own clinics, their own test sites. And I guess to conclude this, all this cost that they're doing, there's a belief that vaccinations could probably reduce that cost. And that's where the weighing of the thought process is. Am I going to create a clinic? Am I going to spend more on this, And can the vaccination help rebalance some of those costs? But again, it's not just cost. It's about safety. It's about reducing this infection, reducing the infections. So I thought that would be something that I just want to leave. Safety and cost is, I think, Melisha, I told you the other time that last year was restrictions.
Yeah.
This year it's going to be vaccinations and moving forward. But that's the big dilemma right now. Is vaccinations going to help the safety environment, and by helping the safety environment, it'll reduce the cost of business? Or is the current cost of business that we're imparting, vaccinations will only be part of that cost? And we should be realistic that the cost that we're actually having right now, it's going to only remain, and then we need to identify a whole lot of variables so that we can survive in the market and recover. But as I mentioned, the big thing to watch out is FDA approval. That's going to change a lot of vaccination-related protocols in the market, and it definitely will hit us in the travel space, international travel space.